think the population of people that we are serving are very, very in-person people. If you can spend some time with them individually and talking to them, you can just make a real difference in their lives.
Just any dynamic in which we are able to kind of invite and honor their perspective and be in a learner role ourselves gives us way more accurate information than we could just guess on our own.
New clothes.
Each time that there's new folks that come into town that aren't really familiar with us, it might take a few different visits of us, just getting to know them or maybe explaining what it is that we offer. So some of the services that we coordinate are outreach to the labor camps where farm workers are living, bringing them food and other supplies that they need when they arrive, and also just trying to build relationships with them and let them know that there's support and people in the area who are interested in connecting them to further services. People who are living in the more remote areas and they don't have as much access to their own transportation have asked us about resources for learning English that they could do on their own or that we could bring along. It's not difficult for them to share needs with us, but I think it takes more than just showing up and asking the question straight out. You kind of have to be a little bit more invested in the long term of getting to know the people that you're working with and their background and their interests for some of that to come out more organically, I guess.
I used to meet with a group of women. They filled the table, they bring food, they brought music, and listening to them, learning about their backgrounds, and just being able to share what resources are available, still planting the seed so that when they're ready, they would be able to express, hey, I'm ready for this service. But definitely meeting them where that and understanding this is going to take us some time before we can build the trust and relationships so we can serve them.
And I think if you can keep a core group of people doing outreach and things like that, then the trust will be there. And they'll be more likely to come, and they'll be more likely to ask you a question that they wouldn't have been able to ask maybe the time before, because now they know you.
People want to talk to you about everything that's going on, and the more you hear and learn about what barriers they perceive that they have or that they know they have, then you can help strategize, okay, how could we get to the root of this problem or get some solutions started.
You do have to listen to the community. You do have to understand the culture and the norms and fit into that.
My thing is with healthcare is you got to treat people as the individual that they are and not as a number, and basically just ask questions. Find out why they're apprehensive. Find out something about them. Ask questions about them. I mean, just nothing personal. Just general questions, and then you can establish trust from there.
We listen to the community. I think the community knows best what is needed. And so as a funder, we have invested in the local federally qualified health center that provides healthcare services to the migrant population. And we've even started providing some innovative dental services to that population as well.
Recognizing how valuable the later night appointments are during the migrant season. And now having this program that we do with folks who live here year-round for dental appointments, knowing that a lot of adults don't have dental insurance or face pretty high costs even if they went through a discounted sliding scale fee. So having the funding to do some specific dental evening appointments that are limited in the out-of-pocket costs for patients has been very popular as well, and kind of something that has continued to spread, I think, in terms of interest and relevance to the needs that they have.
It is not up to us to drop into a community and say, you need dental nights. That was brought to us through our partnership with the Migrant Farm Worker Assistance Fund.
If there's a possibility to be fairly flexible, if in the process you find out that the person has some other medical need and you could make their lives a lot easier by not having to take 2 times off from work, if you can get the medical appointment and the dental appointment at the same place at approximately the same time. You know, they need to have a meeting at school with the teacher, and if you can interpret for everything and just get 3 things knocked out, their employer is going to be a lot happier. And there's just a lot of different things that may be going on that you can learn if you spend some time talking to them.
For me, what is important is the language access. If people reach a facility or approach someone and the language access is not there, they're very discouraged and are bound to turn away and not seek the services no matter how urgently they need them. So language access is key. When they see someone who looks like them, who speaks like them, then there's this relief and they can approach it and they can express what they need, and those come from them instead of an interpreter or translator, which are great services also, but it's a direct one-on-one contact. And so language access has been super important to me because it helps bridge a lot of barriers for families, and it helps bridge a lot of communication, a lot of trust, and that's when relationships really start to build.
When you're looking at trying to navigate those places, you make much more progress with it when you know the people. And so getting to know the providers, getting to know the clinic managers, getting to know the hospital people, having meetings with them before the large group of migrants arrive so that everybody's on the same page about how we're going to serve this large group of people that are coming in for a short time to work.
Once again, I think it's important to listen to your grantees and the consumers about what is needed to actually successfully pull off these programs, and be willing to be flexible and responsive as a grant maker to those needs.
I think for farm workers to have their own voice about what they need, thinking about how important it is to listen to the people you're serving is really important.
Thanks to Suzanne. She does help with getting people to see a doctor, dentist. She helps out with food distribution, and if they can't help you, they'll give you the resources to go and ask. They have been really good with understanding what our needs, so they do listen.